Hello, this is Lauren McNabb, LMT, MTI, and in today's video, I'm going to demonstrate on a client that I've been seeing for about a year on and off. She normally presents with pain in the anterior left shoulder. She had some trauma there, and so she also typically was feeling it in the back of that shoulder as well, kind of under the left scapula. She took a break from getting massages to work with a chiropractor. So she's been getting chiropractic adjustments as well as acupuncture, and that area is actually feeling a lot better. Now she's presenting with pain in the neck, in the scalenes area, and getting some, I believe, nerve pain from about the shoulder to the elbow. That was her main concern today. And she was also feeling just a generalized tightness between the shoulder blades or, in the rhomboid area as well. So when I asked her what she wanted to focus on today, she said her main thing was the pain in her neck. And if we could get to the back, get to the back. And so that's what we worked. I utilized some stretching, gua sha, cupping, and trigger points, as well as infrared therapy. So let's take a look at what we did. So I'm going to start out just with some compressions on the shoulders. It helps the client relax, but I'm also already feeling for tension. She did say that the left side was worse, so that's where I'm going to focus either way. But this is just a good way to kind of warm everything up, loosen it up a little bit, get the client relaxed. So now I'm starting to do almost a little bit of lymphatic drainage just to get some of this fluid moving, kind of working down in the scalenes and just getting some blood flowing a little bit deeper now that I have oil on my hands, and moving everything towards the neck and posteriorly. Now I'm checking the upper traps, just doing kind of some deep Swedish to get her relaxed, get the blood flowing, get the lymph moving, and start to soften up those muscles. Now I'm starting to go a little bit more into the attachments and the end of the trap where it meets the upper delt. She did say she was having some pain down her deltoid as well. So again, really just warming the area up from her neck to her shoulders. Now I'm going in a little bit deeper, turning her head so I can get the side of her neck. A little bit more Swedish as well as lymphatic drainage. She has had surgery recently behind her ear, and it's been a while since her last massage, so kind of incorporating lymphatic drainage and Swedish to warm the area up, just getting a little bit deeper with every stroke. And anytime we're working the neck area, we do want to follow the lymph flow anyways. So even as I get deeper, I'm going from the occipitals down the SCM till I hit the clavicle, going back through the scalenes. Really nice and deep here. I'm starting to feel a knot in the scalenes. And so I'll hold on that for a little bit and give that some pressure. And just working deeper on the neck. This was her main problem area that she pointed to during our consultation, was right there where the neck meets the top of the traps. So I'm really making sure I'm focusing on that area while loosening up all the attachments as well. So now I'm kind of coming in from the side a little bit and getting the traps. Since we did start face up, I do want to make sure I get the traps just a little bit. I really like this technique just for warming up the upper traps because it's using her body weight, and I really just have to slightly curl my fingers and I can pull superiorly and feel any tension there. I think here I'm stopped on a knot. And just really slowly pull my arm out. And that feels really nice for the client as well. I did find a trigger point here in her upper traps, or it might be in her rhomboids. So what I'm doing is I'm going to hold on to that trigger point for a full 90 seconds. Again, my palm is facing up, my fingers are slightly curved, so I have some pretty good pressure on there. And I'm just reminding the client to breathe. And we are chit-chatting a bit. This is a client I typically do chit-chat with, but it also helps her kind of keep her mind off the discomfort. You'll find that sometimes that helps. Some clients don't want to chat, and you can just remind them to breathe. You can tell them to imagine that knot melting a little bit, like butter on warm toast. With every breath out, it gets a little bit softer. So something like that is just an example of a visualization you can use to give your client, and it really does help relax that knot a little bit faster, but it also just kind of gives them something else to think about so they're not so uncomfortable. And then once that 90 seconds is up, I'm just going to kind of slowly wiggle my hand out. You don't want to just pop right back off a knot. You want to kind of work your way out of it just like you worked your way in. So I'm pulling my hand out really super slow and just giving that area some love, bringing some fresh blood to the area. So now from the side, I'm kind of working the trap more down and out. So the upper traps here from the neck to the attachment at the shoulder there. Again, just working really nice and slow. Her knots are pretty deep in there. And remember, like I said at the beginning, it's been a while since she came in for a massage. She has some previous injuries on that shoulder, and the chiropractor has been working with her to resolve the trauma from that injury. And that original area did feel better. So now that things are kind of shifting back into the right place, she's having some other issues come up, which is why I think she's feeling it in the neck and the deltoid now, versus before it was more on her back, like around her scapula. So I'm really just moving really slowly. That way I can warm the tissue up really nicely and make sure she's comfortable, but it does also help me get to these knots and trigger points and adhesions. So here I've found something either in the upper traps or it could be in the scalenes, and so that's what I'm holding on with my thumb. I don't recommend using your thumb too much. You can definitely injure yourself if you're overusing your thumb. That's why I'm working from the side. I'm sitting down here. I'm making sure I'm at a really good neutral angle because it is a little bit more of just hand strength that I'm using. I want to make sure everything else
my shoulder, my elbow to my wrist is in alignment, so I'm not hurting myself. And I'm just moving her arm around just to kind of make sure I'm in the right area and I know what muscle I'm working on. And it's also a bit of a pin and stretch as we hold on really tightly to a muscle and move the area around. So again, I'm just holding on to that trigger point for about 90 seconds. When it gets close to 90 seconds, you should, or you can sometimes, feel that muscle give off just a little bit of a spasm, or you'll feel it relax. And that's also, along with counting, what I'm feeling for. So here I'm about to come off the trigger point, so just kind of wiggling the area, bring some fresh blood, and feeling how loose that upper trap feels now. Reminding the client to breathe. Sinking in a little bit deeper. And now we're coming off that area. And again, once you release a trigger point, you want to make sure you just give that area some nice petrissage just to make it feel nice again, because that can be very uncomfortable. And doing a little bit more drainage here. So now I'm working the rest of the upper trap, feeling for any more adhesions or trigger points. And just working it until the area feels really warm and soft and pliable. So I found another trigger point here, kind of under the shoulder, still on top of the shoulder blade. And so again, I'm just using the technique of palm up, fingers pulled up just a little bit, using her body weight to hold on that trigger point. I'm not using my thumb, I'm not pinching anything. And so I basically just repeat that process over and over again until I feel like I've got all the major knots out and that whole area feels nice and soft. So I'm going to move on to the deltoid now. She really said she was having what sounded more like nerve pain, but nerves can be pinched by tight muscles. So either way, we're going to work it. Working from both insertions, origin and insertion of the deltoid there. Getting the anterior deltoid. And the posterior. This area was really painful on her, and it is painful on most people. The pecs also attach in this area. And so tight pecs, tight deltoids kind of just go together. So this area can be pretty tender, but also very tight. And so again, we're kind of just working it like we worked the traps. Kind of some deep effleurage and petrissage. Warming the area up the best we can. Getting into the pecs a little bit. So the pecs, you're going to work from sternum to the attachment. And I wanted to have her raise her arm up so I could work on that pec in a lengthened position. And so I can really get there in that underarm area. where I think a lot of her pain was coming from. So I went ahead and grabbed a yoga block just so she could rest her arm back comfortably, because it was not going to go all the way to the table, but I still wanted her in that position. And I'm going to place some cups right there on the head of the humerus, right there on the glenoid cavity, the GHJ, whatever you want to call it, and getting the attachments of the pecs and right in there around the deltoid. This area is super sensitive on a lot of people, and especially this client. She came in saying this area hurt, and even though it seemed more like nerve pain, she definitely had a lot of tightness in the area. And I'm applying the cups in this position just because it opens the area up a little bit more, and I'm able to get into those difficult to reach areas. But her pec isn't fully extended, so we still have some room to move her around and do like a pin and stretch kind of technique. But while those cups are there on her pecs and delts, I'm going to go ahead and just keep working the bicep and tricep, working her forearm, working her wrists and hands, because she is getting pain from her shoulder to her elbow. But we know this whole area is tight. She does a lot of driving of heavy machinery for work, and so that's going to cause tightness in that whole area. And it just feels good. You know, while the client has cups on, they're very uncomfortable. And so if you work something that's maybe not as painful, again, it's kind of a distraction and helps them focus on something else besides that intense feeling of the cups. I also went ahead and turned the infrared light on, because that's going to keep that area really nice and warm and keep the tissue nice and pliable, and it's going to help the cups work better, help that blood flow, and it just feels really nice and relaxing as well. So now I'm going to start stretching and having her rotate that shoulder, because her range of motion was pretty limited here before we started massaging and did the cups. So if I can get that to stretch with the cups on, she'll have an even more increased range of motion when the cups come off. Doing a little bit of lymphatic drainage here, just because this area probably does have some swelling in it. And some more stretching. That's going to stretch her pecs, triceps a bit, lats a little bit. Just doing some more rotations there. Pressing down towards the floor, very, very gently. And you can see her arm's already laying back more flat on its own than it was before. And I'm having her just move it on her own with those cups still on there. And doing some internal and external rotations. Bringing the arm across the chest, stretch the deltoid. Alright, we're going to go ahead and remove the cups. Give those just a very light massage in a circular fashion. That helps that redness go away a little bit faster. The client should be feeling some big relief now that those cups are finally off. And we can get in there and massage a little bit more. So I'm working the pecs a little bit deeper now with my knuckles. Starting at the sternum, kind of following the clavicle, and all the way out to the deltoid, and working the deltoid again. And we're working bicep a little bit here too, but my focus is the deltoid, especially with these rotations here. So again, I'm just kind of giving that area some love. It's just really intense with the cups on there. And I'm checking that upper trap again. Feels a lot looser now. And that upper pec and deltoid. Should be nice and loose. And now that I'm getting more movement in there, I'm able to get a little bit deeper. So I'm just going to go back and kind of double check everything. Double check the trap and the neck and finish up that side just how we started it, with some long, slow, deep strokes. Now that everything's loosened up, we're able to get in there a little bit better, get out a few more small knots. Double checking to make sure all the knots are gone out of the scalenes and the upper traps. moving nice and slow and controlled. Here I'm checking the occipitals, just getting kind of the attachments of the neck here. And again, moving down towards the clavicle to follow the path of the lymph. So just double checking the upper traps again while I'm sitting at the head of the table. Double checking for any trigger points and holding them for 90 seconds when I find them. And just going over the pecs and the deltoids one more time. Moving everything down, away, because that shoulder was very tight when we started. And this also helps with lymph drainage as well. And I'm checking range of motion here. She's able to bring that arm up a lot better. And when she's in that position, I can grab that upper pec. And just kind of double check that for any residual tension and any knots. This area is very sensitive on people, so make sure it's really good and warmed up before you grab in there. Clients can also be ticklish. If they are ticklish, don't use your fingertips like this. I would recommend using your fist or avoiding the area altogether, because if a client is very ticklish, this is just going to make them tense up more. So you can work the areas around it, but don't work over and over again in an area where the client is ticklish. I'm speaking from experience. I'm a very ticklish client, and I know I'm tight in my axilla, but the more a massage therapist will try to work it, the tighter everything else gets, because I am clenching up and tightening and pulling away. So always verbalize with your client if something's uncomfortable, or watch for body language, because you don't want to keep working an area just because you feel like it needs to be worked. Meanwhile, the client is more and more uncomfortable. We definitely don't want that. So I'm going to start on the right side now. The right side is not as tense, but you do want to make sure your client feels pretty even. So even if the left side was hurting, we don't want to ignore the right side. But we're basically doing the same thing, starting off with some effleurage and petrissage, following the lymph drainage, getting into the scalenes. I mean, she definitely does have some tension on the right side, but not to the level that the left side was, and not experiencing any pain on that side. So we're not going to spend as much time there. I didn't do the cupping and the stretching and all of that. Just kind of some basic deep tissue and deep Swedish, just to make sure she's even. And she was pretty even, so we're going to go ahead and turn the client over now. So now on her back, she was feeling tension, kind of described it across her bra line, a little bit higher than that, so probably traps, rhomboids a little bit. When someone's pecs are really tight, their upper back is going to be overstretched. They'll feel tense, but the muscles themselves won't actually be in a shortened position. They'll actually be in a lengthened position. That's how most of your clients are going to look, because we live in a very hunched over society. We're hunched over on our phones, we're driving, we're on computers, things like that. So our pecs get very tight, our upper backs get over lengthened, but because of that constant tension on them, the pulling from the front of the body, the back of the body does feel tense, tight, painful, achy. You get burning sensations from the nerves being irritated. You get trigger points, all those kind of things. So I did recommend this client do her stretches. The chiropractor has given her some stretches to do. She did say afterwards that they were easier now that she had the range of motion in the pecs. But for her upper back, we are going to be focusing the area that she said was hurting, but also double checking those upper traps that we just worked as well. Remember, while she was face up, I got a few little trigger points out from the traps already. So I just start out with the soft silicone cup to start loosening up the fascia and get some blood flowing in the area. I went ahead and left that cup there just to help with some lymphatic drainage as well. Now I'm doing a little myofascial release, nice and gentle. A pin and stretch along the erectors. More myofascial release. So I'm not going very deep here at all. So with this first pin and stretch with my elbows here, I kind of pre-testing the area. I'll usually feel some knots doing that, so I know where I need to go back and focus on. And this is when I go ahead and turn the infrared heat on. She's been on the table face up for a while, so the heated table does warm up the area a little bit, but these tissues cool really quickly, and I need everything to stay nice and soft and pliable. So that's when I turn the heat lamp on. I start with the erectors. Again, we spent a lot of time here already, so I don't have to spend too much time on her neck. If she were to start face down, I would definitely be spending more time on the occiput and the neck and the scalenes, but we already got that pretty good with the first half of the massage. So now I'm more worried about loosening up along the spine, which is why I'm moving away from the spine. Which I know it sounds a bit counterproductive when we already know the back is in a lengthened position, but it is still good to work those attachments because she is feeling tension in that area. So I'm already double checking the areas that we went over, making sure there's no knots in those upper traps. And this is where we're going a little bit deeper, moving things towards the spine. Because again, the muscles on the back are in a lengthened position, so we want to move them towards the spine in a shortened position and use a lighter stroke when we're moving back out. I'm going to go ahead and do some gua sha as well. So I'm working away from the spine. Again, just to kind of loosen up that tension there. And moving up and down along the erectors. I'm just repeating that from the mid-back up to the neck. This is going to bring fresh blood flow and loosen up the fascia and the attachments there. You don't want to overwork it. You just want to use these tools until you see petechiae or see the area getting red. But when you see petechiae, that's when you know you're good and you need to stop. I went ahead and moved her arm back because I want that in a more neutral position for when I place cups, and also so I could get that gua sha kind of around her scapula. But you notice how she feels more comfortable with her arms forward in the armrest, because again, that's how most of us are all the time. And laying your arms back flat on the table can actually feel really unnatural. So that tells me, even though we just worked for 30 minutes on the front of her body, it's still tighter than the back of the body. So I really like to work a majority of my time on the back with their arms back by their side in that neutral position, because that's where we want them to feel comfortable. And with her arm in that position, I'm going to go ahead and place my cups. So I like to feel around, see where I still feel some adhesions or possibly some trigger points. Her upper traps were a concern, so that's where we're starting. And then just kind of feeling down along the scapula. And you can get cups pretty close to the spine, but not on the spine. The soft cups can go over the spine or even sit on it, but these hard cups, you want them off to the side along the erectors. But I do like to just kind of feel around, because I'm going to go back over this area and get all the trigger points out. But hitting them with the cup first, even at a low pressure, these cups go up to 5 pumps, but the most I do is 2. I've done 3 on some clients, and they told me don't do that again. It was a little too uncomfortable. So I keep the cup pressure pretty low. And while those sit there, I have the heat lamp on them, and I'm going to go ahead and move on to the right side of the back. Now, if I were doing her whole back, I'd be working the low back at this point. But again, we're over halfway through the massage. I want to use my time efficiently and hit all her problem areas. So I'm just doing the same thing on the right side, starting with the soft silicone cup. Just to start loosening everything up. This is really good for myofascial release. And so here I am spending a little bit more time on the occipitals because I didn't while she was supine. And doing like a pin and stretch, holding on to the occiput while moving down the traps towards the shoulders. That feels really nice. And checking the attachments of the traps, running my fingers along the clavicle and the spine of the scapula. And then again, with deeper pressure, moving down, because we want to shorten these muscles. And same thing, just getting the gua sha tool out again, going up and down the erectors as well as away from the spine. And now that that lamp has been on those cups for a while and the cups have been on a while, it's time to get them off. But first I am going to do some movement and stretching with the cups on there. And it felt pretty good, so I went ahead and took the cups off. And once I took the cups off, just kind of gave that area some petrissage. Going back over a little bit deeper, and at the same time feeling for any more trigger points that I might have missed. Now I'm really kind of honing in and trying to find a trigger point or two. I know they're there, but at this point, they're pretty little. They're a little bit hard to find. But I found one, so we're going to hold it for 90 seconds. And that feels pretty good, so we'll go ahead and slowly move off that area. Check it again with the elbow. Nice and slow. Remember, the deeper you go, the slower you go. So when you're using your deeper tools like your forearm, your elbow, go nice and slow. And now I'm going to move on to the other side. Remember, we already warmed this side up. It's already been gua sha'd. So it's safe to go ahead and go in with the forearm and the elbow, working right along those erectors. Really slowing down on those problem areas, that mid back that the client let me know about and that I felt. And now we're just going to get some hot towels on there. This just feels really good. You could do hot towels really at any point if you want to start with hot towels to warm up the area. If you don't have a heated table or an infrared lamp, sometimes I'll do it before putting cups on. Sometimes I'll do it after putting cups on, but before getting the trigger points out. Now I'm really just using it to kind of melt away any other tension that could be left. And we just finish it up with some pain balm and some nice firm effleurage.
After this visit, the client had immediate increase in range of motion on that left shoulder and a decrease in pain. She wasn't feeling that nerve pain going down her arm, and her neck was feeling a lot better. So while the massage was intense and uncomfortable at times, we did need to really get in there and get into those problem areas to help her out. So she has another follow up in a month, and I hope to continue seeing her for maintenance. Thanks for watching. Be sure to like and subscribe for more.